I feel a little offended to be called Your Excellency. I'm safer when you call me Governor or just Orengo. That's good enough. But as you know, health is devolved, agriculture is devolved, um, county roads are devolved, and pre-primary education is devolved, and agriculture is devolved. So as we visit health facilities, is not by accident. We are conscious of the role that the county government is supposed to play. And one of those sectors is the health sector. And in our manifesto, we put a lot of emphasis and premium on health, agriculture, pre-primary education, and county roads. And of course, with the blue economy, there's emphasis there as part of the big question about agriculture as a whole. We're happy, the doctor, for having us here together with Waziri. From the facilities you have, I think I must say you're doing a good job, but it's not the best because we need more doctors here. I've been told we only have 4 doctors. I think this facility will do better with about 15 doctors, seriously speaking. And also, as Dr. Chanda has said, in terms of facilities, we're grateful that there's an oxygen plant here. We're grateful there are equipment in the Department of Radiology and so on. But the bottom line is that we have to do better to provide a better working environment for the staff who work here, and also to be able to provide better services to the people and the patients who come here. And it is our commitment to make a difference. We're not here to impress people. We are here in our line of duty. And after every visit, we sit down and we try to determine what quick wins we can make or gain, and what can we plan for the near future or for future purposes. One of the things that I think we should address is the water problem, not just in Bondo as a town, but in this health facility. We must put ourselves in a situation where we can have water around the clock. Even the wards that we've toured, again, I think they are makeshift. To be a level 4 hospital, I think even in terms of brick and mortar, we must be seen to be doing a better job. Other counties have done it. I was seeing the other day in Kilifi, they have built a magnificent building to house the hospital there. So we're hoping to make a difference, particularly in the areas that we have pointed out. Out there, if you talk to the public, they see more problems than service. And we must address those problems that people keep on talking about. I also am not happy that the morgue here is not refrigerated. In fact, all the level 4 hospitals, or all the hospitals in Siaya except Yala, the public hospitals, they don't have a proper morgue. And this morgue has got a big population. But thanks to you, the staff here, without refrigeration and with by just using chemicals and embalmment, you keep it in that condition. Even me walking into the morgue, and I've been to many morgues before, but I'm surprised that they are kept to that level of cleanliness without refrigeration. So I'm hoping that that's one of the quick wins that we can try to think about. At least Siaya and Bondo should be upgraded. we're not just thinking about the dead, but even the living. We need to upgrade the facilities in Bondo. You have enough land for expansion. In fact, in terms of the near future, I think you don't need more land really. This land is expansive for development, and we're going to try and do our best to make appropriate plans to make this facility better for our people, and even people from other counties, because they're not very far from Kisumu County and the other sub-counties in Siaya County. So I hope that in the next days and weeks, we are going to continue to make these visits so that we can see for ourselves what needs to be done and to determine the actions and the solutions for the problems we may face. For very practical problems, we have a shortage of drugs, especially in the other facilities, in the dispensaries, the health centers. And we have managed to resolve that issue. But the supplies may take a little time, 2 weeks. I think we're back to normal. What we are promising the people of Siaya, that we don't want to think about drugs when there are no more supplies. I think we'll be more strategic to ensure that there are drugs, at least the basic drugs, available in all our health